my mother was a diabetic, and all of her siblings were diabetic. So it was my worst fear that had come true, that I too would have to inject myself.
When it comes to taking insulin, it's common to feel unsure and maybe even scared. Your diabetes care team is there to help you learn how to properly take your insulin. This will help you gain the confidence you need to manage your diabetes. Methods of taking insulin include syringes, pens, and pumps. Because insulin pumps require individual instruction, this program will focus on using a syringe for a single or mixed dose injection, and using an insulin pen. Insulin syringes are smaller, their needles sharper, and easier to use than ever before. This helps lessen the pain of injection. Let's look more closely at the syringe. The barrel holds the insulin. The insulin user pushes the plunger to push the insulin out, and the plunger also shows how much insulin is in the syringe. The needle is sterile and shouldn't touch anything before the injection. U100 is the standard for insulin used in the United States. That means each cc contains 100 units of insulin. There are different sizes of syringes. Ask your diabetes care team what size syringe you should be using for your insulin dose. Some people use just one type of insulin. This is called a single-dose injection. Others combine different types of insulin in one syringe. This is called a mixed-dose injection. The only difference between how to inject a mixed dose and a single dose is the way you prepare the syringe. Let's go over step by step how to prepare to inject using a needle and syringe. First, gather all your materials on a clean surface. This includes the syringe, a clean damp cloth or alcohol swabs, a sharps container, and your insulin. If you need to inject a mixed dose of insulin, then have both bottles ready. Wash your hands thoroughly with soap and warm water and dry them on a clean towel. To prepare a single dose of insulin, clean the top of the bottle with alcohol. Insulin is either clear or cloudy. Cloudy insulins must always be mixed thoroughly before use. Clear insulins do not. If your insulin is cloudy, mix it thoroughly by rolling the bottle in your hands or rotate it from top to bottom. Be careful not to shake it. Turn it over and make sure there is no powder left on the bottom. Pull the plunger back to the number of units of insulin you'll need. Inject that air into the insulin bottle. While the needle is still in the bottle, turn the bottle upside down. Make sure the needle is covered by insulin. This prevents an air bubble from getting into the syringe. Pull the plunger back to the correct number of insulin units. Check the syringe for an air bubble. An air bubble is not dangerous, but it takes up space and can cause you to measure the wrong dose. If you see an air bubble, push the insulin back into the bottle and fill the syringe again. Put the syringe down. Make sure the needle doesn't touch anything. If the needle on your syringe is bent, you must discard it and start again. Now you're ready to inject. We'll discuss injection in a moment, but first let's look at a mixed dose of insulin using a syringe. Some insulins come pre-mixed in a single bottle. For example, 70/30 contains 70% NPH and 30% regular insulin. However, sometimes you need to mix two types of insulin together in the same syringe. If you are asked to use a mixed dose, this usually means combining a shorter-acting insulin with a longer-acting insulin. To prepare a mixed dose of insulin, you'll need to do a little math. Write down the number of units of longer-acting insulin you need to take. That might be 16 units. Then write down the number of units of shorter-acting insulin you need to take. Let's say you need 8.
24.
Add both figures together to get the total number of units you'll be injecting. In this case, 24. Wipe the tops of both insulin bottles with an alcohol swab or a clean damp cloth. Pull the plunger back to the number of units of longer-acting insulin you need, in this case, 16. Inject that air into the bottle of longer-acting insulin. Do not begin drawing the insulin yet. Instead, pull the syringe straight out. Now draw in 8 units of air and inject it into the bottle of shorter-acting insulin. This time, leave the needle in and turn the bottle upside down so that the insulin completely covers it. Then draw out the correct amount of insulin, 8 units. Be sure to check for an air bubble. If you see one, push the insulin back into the bottle and start over again. Now for the longer-acting insulin. First, mix it gently, but thoroughly, about 15 to 20 times. Insert the needle into the longer-acting insulin bottle and turn it upside down, making sure the needle is completely covered with insulin. This will help keep an air bubble out. Carefully pull the plunger back to the total number of units you want to inject, 24 in this case. You need to be especially careful at this point. If you draw up too much insulin or see an air bubble in the syringe, you cannot push the mixture back into the bottle. You must dispose of the syringe and start over. Also, if the needle on your syringe is bent, you must discard it and start again. It may seem complicated now, but with a little practice, preparing a mixed dose of insulin will become second nature to you. If you have special needs, such as visual or movement problems, your diabetes care team can introduce you to devices that make it easier to hold the syringe and bottle. Some people who inject insulin use an insulin pen. There are pens that use disposable cartridges, and there are disposable pens. At first glance, the insulin pen looks a lot like a writing pen, but it has a needle instead of a writing point, and an insulin cartridge rather than an ink cartridge. Though you can't mix different types of insulin and put them into an insulin pen, pens do come pre-mixed.
The insulin pen to me is freedom because I can stick it in my purse, I can dial my right proper dosage, I can inject myself and no one has to know what I'm doing. It's just the convenience of being able to have my medication with me at all times.
Keep in mind that there are several different pens to choose from, and each will have their own special instructions. Work with your diabetes care team to find the pen that works best for you and learn how to use it. The following step-by-step preparation method can be used with most insulin pens. Before starting, always make sure that your pen or cartridge contains the type of insulin that has been prescribed for you. Gather your supplies. They include your pen, needle, clean damp cloth or alcohol swab, and a sharps container. Wash your hands with soap and warm water and dry them. Pull the outer cap off. Wipe the rubber seal at the top with alcohol or a clean damp cloth. Get the needle and take the protective paper tab off. Screw the needle onto the pen tightly. You'll notice that it is still in its protective cap. Remove the outer needle cap. Take off the inner needle cap. It is important to prime your pen before each injection to help ensure your proper dose. This means doing a trial air shot before injecting insulin. Pull the dose knob out until an arrow appears in the window. Dial your pen to deliver 2 units of insulin by turning the dose knob until you see a 2 in the window. Point the pen straight up and push the injection button. You should see insulin come out of the needle tip. Now you can set your dose. Turn the knob until your dose appears in the window. If you're using cloudy insulin, roll the pen between your hands and tip the pen end to end to mix at least 15 to 20 times. Now you are ready to inject your insulin.
Don't be scared. It's just a needle. Just a pinch. Just remember, it's good for you.
Whether you're using a syringe or insulin pen, insulin should be injected into fatty tissue. The recommended injection areas are the abdomen or belly, the back of the arms, the tops or sides of the thigh, and the buttocks or rear. With most insulins, where you inject on your body can make a difference in how fast the insulin will go to work or its onset. Generally, the abdomen works fastest, followed by the backs of the arms, the top or outer thigh, and then the buttocks. Work with your diabetes care team to find the injection area that is best for you. Try to use the same area at the same time every day. For example, if you take insulin twice a day, you might make your abdomen the area for your morning injection and your thighs the area for your afternoon injection. Although it is important to use the same area at the same time every day, you should change the actual injection site each time you inject. This helps keep your skin and underlying tissues healthy. When injecting into your abdomen, make sure to stay 2 inches away from any scar tissue or your navel. If you're going to engage in an intense workout, be aware that injecting a part of the body that you're going to exercise can cause your insulin to work more quickly. For example, if you inject your leg and then go for a run, your blood glucose level may drop more quickly and go much lower than usual. So before a strenuous run, you may want to choose a different area, and you may need to eat a snack before your run. Once you have selected an injection site, wipe the skin with alcohol or a damp cloth and wait a few seconds for it to dry. Pick up the syringe or pen and pinch up your skin. Inject at a 90-degree angle. If you are very thin, you may be advised to inject at a 45-degree angle to avoid injecting into muscle. Press the syringe plunger firmly and smoothly, or firmly press the insulin pen injection button. Depending on the pen you are using, you may have to hold it for at least 5 seconds. Then pull the needle straight out. After taking the injection, drop the syringe or pen needle into a sharps container, which you can get at your diabetes product supplier. If you don't have a sharps container, a heavy plastic bottle with a tight-fitting lid clearly labeled that it contains medical waste will work too. In some areas, you are asked not to put filled sharps containers in your regular trash for collection. Your diabetes care team can tell you if your community has a specific place to take your sharps container when it is full. New methods of insulin delivery are constantly being introduced. Breakthroughs frequently occur to make insulin delivery easier today and in the years to come. By practicing and working closely with your diabetes care team, taking insulin will become a valuable tool in your blood glucose management.
So proper dieting, exercising, taking my insulin, monitoring my blood sugar, it's part of my life. It's part of who I've become.
Once you start doing those things that you need to do, it become habitual. Just like when I take my insulin, I don't even think about it. I just do it. It's become a natural part of my everyday existence.
I can't tell you how much it's affected my life. For the first time, since I had been diagnosed with diabetes, I felt like I was controlling the diabetes rather than it controlling me.